Hi, my name is Molly Punchal,
And I'm Parker Dane.
and we are the Environmental and Public Health interns at the City of Kansas City Health Department. So, throughout these 5 weeks, we have been scrutinizing the question of how might we make the public realize the importance of environmental public health.
So, one of the things that environmental health does is it does inspections. Inspections on restaurants like ones that you see here, with dead rats in the oven. Ew, right? Rats in your food? Maybe not the best thing.
So, at one of the inspections I was at, I witnessed people like handling food with their bare hands without engaging in proper hand hygiene, and also making food on the dirty floor.
All right.
So, environmental health is so crucial because around 48 million people suffer from foodborne illnesses each year, and also around 3,500 people die from drowning each year. So, we address that the biggest problem with environmental health is that individuals don't know what it is, how important it is, or how to find resources about it. So, this leads to owners of establishments like pools and restaurants not to be less likely to cooperate with the health inspectors that come in. And it also, so due to the lack of awareness, it makes people less likely to reach out. And it also causes issues with the legislator and the funding for environmental health.
So, another problem that we found came from statistics. So, we interviewed 58 members of the public, and we found that 53% of those people said that they knew what environmental health services were. However, with further inquiry, 29% of those people did not actually know what it was. They either provided an incorrect description or definition of environmental health services. Along with that, 36% of people did not feel confident they could find information about environmental health services. They didn't know where to go for food handler cards, lead prevention, or other things that environmental health services offer.
So this leads to our first solution, which revolves around the idea of launching a social media campaign. So since we live in a digital world, our plan is to have a strong, consistent, and effective social media page that is frequently updated because the Kansas City Health Department doesn't have a strong presence in social media right now. So we took a survey of our peers, and 90.2% of our respondents said that they would pay attention and check to like the social media posts that we want to post.
So, our second solution is an informational promotional video. We found that 41% of survey respondents said that they would look at or listen to an informational video of this kind. A video of this kind would include things like information about environmental health services and what we offer, and also attention grabbing topics like dead rats or lead in young children. And also, similar to Super Bowl ads, having a prominent public figure would generate interest and viewership, making it more meaningful and more effective as an informational campaign.
So our last solution addresses the people who aren't on social media and speak various languages. So our plan would be to mail brochures to each household in Kansas City to address both those people. And even though this might add more to the cost, it is still going to have a greater and more profound effect because it's going to reach more people.
So, speaking of the cost, our budget is quite a high one, $446,000. So let me break that down for you. Our mail campaign would cost about $80,000. A video, including editing, would cost around $9,000. A celebrity appearance would cost around $300,000, which is a lot, but we're hoping that we can get volunteers or celebrities at a lower price, as this is an informational public campaign. And the social media manager's salary for 1 year is $57,000.
So starting off with our timeline, so the first month we would be beginning our social media campaign, then the second month we'll be sending out the mailers and then beginning the videography for the promotional video. Then the third month we will be finishing the video and then sharing it on various platforms, and then the fourth month we're going to be going through the various responses that were received from the mailers to continue to update the social media platforms.
So, our first ask was the budget, and our second is that we change the way that the public thinks about environmental health. The 67.7% of survey respondents believe that environmental health meant something to do with saving the trees. And while that's not incorrect, it's also not what we want them to think. We want them to think of environment as everything around us, where you sleep, eat, work, send your children to daycare. More public interest comes from where you send your children to daycare and if they're safe than from hugging trees.
Okay, So, our final ask is that we ask for there to be more information and to spread awareness through various online platforms and through mailing brochures, as well as a promotional video being made by the City of Kansas City Health Department and to advertise the importance of public health. And then it would be added to the Kansas City Health Department website and then further to be added to various social media platforms.
All right, thank you so much for judging us today, and please scan these QR codes. One is for the public interviews, our data from that, and one is from the results from a survey of our peers. Feel free to look at that information.
Thank you.